Unfortunately, a person's worst day is a normal day for our crews. And when that emergency strikes, and who knows what it is, they have to be ready for it.
GMR is on healthcare's front lines. The first call in an emergency involving high acuity, life-threatening, and time-sensitive situations.
No one wakes up planning an emergency. Much of what we do is preparing to respond to those unplanned events rapidly, effectively, and with the right tools.
We respond at a moment's notice. As soon as the call comes in and we deploy the resources that we believe are necessary for that individual that's in need.
Our crews are ready 24/7. That readiness, that ability to be there when there's an emergency is something that's core to what all our caregivers believe in. And it's not just actually transporting patients, it's actually taking care of people where they're at.
Over 60% of the U.S. population resides in a county served by GMR. Our extensive scale and logistical expertise ensures we can respond in a moment's notice. We respond to 11% of all 911 and 33% of air ambulance calls in the United States.
Every community is different. Some need large ambulance deployment centers with 50 or 100 ambulances. Other communities only need 2 or 3 ambulances. Some need 2 or 3 air ambulances in a large geographic area, some just 1. So our ability is scale and scope of what GMR does allows us to put the resources needed for that community.
When you think about the system, and quite frankly, sadly, the lack of access to the healthcare system, we're it. There are communities in this country, especially in the rural settings, where we are the healthcare system. We're the only access to care for these individuals.
There is no average day in EMS. Our experience and our expertise is driven by the patient populations we see. So for example, in a single day in GMR nationwide, we'll see over 200 critically injured trauma patients. We'll see over 130 patients who have an acute stroke. We see about 90 cardiac arrests in a day. We know how to manage the population because we manage so many.
We operate in 50 states. We respond to a situation almost every 90 seconds. That's just about 6 million patient encounters a year. You think about the number of people that we touch as an organization. How do you do that? You do that with close to 25,000 clinicians, a team supporting them, with 500 air apparatus, 8,000 ground apparatus, delivering healthcare at a moment's notice anywhere. Why do people call 911? Think about that. Do you call 911 because you need to be taken care of?
30% of all calls do not need to go to an emergency room. So having a nurse navigation system so we can actually navigate patients to their right destination of care is something that's critically important for communities. So those people are not backed up in an emergency room. Those patients can get care right away.
We can have you speak to one of our nurses who's qualified to walk you through what your current dilemma is and maybe get you to a different site of care, an urgent care center, or maybe get you to do something at home while we follow up with you the next day. We've responded to the need. I often remind people those ground and air assets are mobile ICUs. They're miniature, emergency rooms that happen to be either on wheels or on wings or on rotors getting to you.
In the event of a large-scale disaster, GMR works with states, the federal government, and health systems.
Through our Office of Emergency Management, we're in essence the easy button for a disaster. We deploy within 24 hours.
GMR can augment local 911 services by providing emergency treatment in the field, providing medical standby for search and rescue, and transporting critical patients from impacted facilities to those with power and water.
So what's GMR's why? And the why is truly the patient. And for us, that's not a saying that we put up on a poster on a wall. It's what this team lives every day, day in and day out.
There's an art and a science to everything we do. The science is the drugs, the tools, the approaches, the readings, the EKGs. The art is the humanity. It's the connection. We're there to support, to walk them through, and to use that humanity to say, we got you.